Say goodbye to overwhelming textbooks and hello to vibrant interconnected mind maps. We welcome you to our new series of videos where we pick each mind map from our mind map bundle and help you run through all the important points you need to remember for your exams. This video discussion will be on the topic of tongue. Starting with gross anatomy. The tongue is indeed divided into three parts based on its embryonic development and innovation. Anterior 2/3 of the tongue, posterior 1/3 of the tongue, and the posterior most part of the tongue. The sulcus terminalis is a shallow V-shaped groove on the upper surface of the tongue that marks the boundary between the anterior 2/3 and the posterior 1/3 of the tongue. The artery chiefly responsible for blood supply to the tongue is the lingual artery, which is a branch of the external carotid artery. It travels between the middle constrictor of the pharynx and the hyoglossus muscle and ultimately ascends to the tip of the tongue, providing oxygen and nutrients to the tongue muscles and tissues. The venous drainage is through the paired deep lingual vein and the dorsal lingual vein, which ultimately drain into the internal jugular vein. Coming to the lymphatic drainage, it can be divided on the basis of areas draining. The lymphatic vessels from the root of the tongue drain into the superior deep cervical lymph nodes. Lymph from the medial part of the body of the tongue is drained by the inferior deep cervical lymph nodes. The lateral part of the tongue drains lymph into the submandibular lymph nodes, and lymph from the frenulum and the tip of the tongue drain into the submental lymph nodes. 4 types of lingual papilla are found on the surface of the tongue: filiform, fungiform, fallate, and foliate. Their characteristics can be noted from this table here. Next, we come to the muscles which form the tongue. They are intrinsic or extrinsic in nature. Intrinsic muscles which are located within the tongue are superior longitudinal muscle, which lies in the submucosal connective tissue. It shortens the tongue, curls the apex and sides of the tongue, making the dorsum concave. Inferior longitudinal muscle, which lies close to the inferior surface between genioglossus and hyoglossus. It shortens the tongue, uncurls the apex, and turns it downward, making the dorsum convex. The third one is the transverse muscle, which extends from the medium septum to the lateral margin. It narrows and elongates the tongue. Lastly, we have the vertical muscle. It's in the submucosal connective tissue on dorsum of the tongue to ventral part of the tongue. It makes the tongue broad and flattened near the margins. Coming to the extrinsic muscles of the tongue, which are located outside the tongue but are attached to it. The first one is genioglossus muscle. It protrudes the tongue, prevents backward falling of the tongue over the larynx, hence is considered the safety muscle of the tongue. Hyoglossus muscle is responsible for depression of the sides of the tongue and making the tongue convex. Styoglossus muscle causes retraction of the tongue and pulls the back of the tongue superiorly. Lastly, palatoglossus muscle is the muscle of the soft palate and the tongue. It elevates the back of the tongue and moves the palatoglossal arch towards the midline and depresses the soft palate. These movements facilitate the closing of the oropharyngeal isthmus and separate the oral cavity from the oropharynx. The sensory and motor innervation of the tongue is different for different parts of the tongue. You can pause the video here and make a note of this table for learning this quicker. Tongue is an important part of the oral cavity, and some clinical correlations seen with respect to it can be acute or chronic glossitis, ankyloglossia, and carcinoma of tongue. With this, we come to the end of this video. Hopefully, you have noted down all these important points about tongue. You can head over to the MCQ section on our app to try and solve questions now. Good luck!